Hello, we are the Knowles Insurance Agency, husband and wife team Richard and Samantha Knowles. We've had the great privilege of serving Medicare beneficiaries for over 16 years. Today I want to talk a little bit about Medicare Advantage plans. If you're watching this, you probably have your red, white, and blue Medicare card. You're turning 65 or you're already 65. That red, white, and blue Medicare card is going to have your name, your Medicare ID, and then it's going to have a Part A, which represents the hospitalization portion of Medicare, and a Part B, which is the doctor services. And you'll have effective dates for both of those. That represents your Medicare coverage. That card alone offers you nationwide coverage and flexibility to see any provider, any specialist that accepts Medicare. There are no referrals needed with original Medicare. However, you'll want to note that Part A and B do not cover everything. There are deductibles, copays, and 20% coinsurance for all medical, surgical, doctor services with no maximum out of your pocket, which could add up to a lot pretty quickly. People choose to limit their out-of-pocket exposure by enrolling into either a Medicare Advantage plan or a Medicare supplement, also called a Medigap. There are other types of coverage that you could have, like employer coverage, retirement coverage, union, VA, Medicaid, but today we're simply going to talk about a Medicare Advantage plan. So Medicare Advantage plans are an all-in-one bundled plan. They're also referred to as Part C. They're offered by private insurance companies that are approved by Medicare. Medicare pays these companies to cover your Medicare benefits. If you join a Medicare Advantage plan, the plan will provide all of your Medicare Part A and B coverage. The insurance company becomes your primary payer, not Medicare. Medicare Advantage plans must cover all the services that original Medicare covers. Plus, they usually add some extra benefits like dental, vision, or wellness, and most include a drug plan. If the plan has a premium, you will pay that in addition to your Part B. Some people think that you don't have to pay your Part B. You absolutely must have your Part B and continue to pay the premium for your Part B as you enroll into your Medicare Advantage plan. Most Advantage plans will have a very low or zero premium, and you simply pay copays when you use the plan. For example, you may have a plan that has a $30 copay to see your specialist, a $20 copay for labs or x-rays, or larger copays for hospitalization. And remember, we talked about original Medicare does not have a limit out of your pocket. The Medicare Advantage plans have a maximum out of your pocket. Also, these type of plans have an annual enrollment period. At the end of every single year, you'll always have the opportunity to make changes. But remember, you're locked in for the year, so if you want to make another change, you'd have to wait until the next year's annual enrollment period. The networks. Remember we said original Medicare has nationwide coverage to see any doctor, any hospital. Advantage plans are a little different. They have smaller county-related networks of doctors and hospitals. It's usually a group of counties. It may be an entire state. Depending on the plan that you choose, you will want to use network providers. And you always want to make sure that any doctors you're committed to take the plan before you enroll. Be sure to include any specialists like a cardiologist. If you have a durable medical equipment provider, you want to make sure that those providers are in the network or be open and flexible to changes. Now, there are different types of network plans. I'm going to show you the different types of Medicare Advantage plans, and I'm just going to go over it briefly with you. So let's take a quick glance at the types of Medicare Advantage plans. These are obviously going to be different in different states, in different cities, in different counties. But these are the overview of the different type of Medicare Advantage plans. The first one is an HMO, Health Maintenance Organization. Most HMOs, you are restricted to the network. You must go see the doctors and hospitals in the network, and most of them you require a referral from a primary care doctor to see a specialist. Preferred Provider Organization, PPO, you pay less if you use in-network providers. However, you can go outside the plan's network and you'll pay a little more. A PFFS, Private Fee for Service. This is these plans are not always available in all counties, but it's a lot like Original Medicare. You can basically go see any doctor or healthcare provider as long as they accept the plan's terms and payments. The only thing I want to say about a fee for service, just because you go see a doctor in January does not mean when you want to go see them again in June, you can. You have to check to see that they accept the plan's terms and conditions every single time you want to go see a doctor on a fee for service. SNP, Special Needs Plans. Those are specialized health care. That's usually for low income that goes along with Medicaid or chronic medical conditions. Then we have an HMO POS. Those are not super popular, but you can see that you can get some out of network services for a higher copayment. So there's a little more flexibility with that type of plan. And then you've got MSA plans. So that's an overview of the different Medicare Advantage plans. If you seek treatment from a non-preferred provider with the HMO, you're going to pay the full cost. So you're going to want to stick to the network. And it's always a good idea to become aware of your network prior to enrolling. These are coordinated care plans, so they're designed to help guide you with your medical care. The HMOs require referrals. In the event that your PCP, your primary care physician, that they cannot help you, they will simply refer you to a specialist. You don't have to go searching for one. Some people really like this aspect that their primary care assists them and helps guide their care. Referrals are not required with the PPOs, but it's still recommended to use in-network providers so you'll pay the least out of your pocket. In all type of Medicare Advantage plans, you're always covered for emergencies and urgent care even outside the network's service area, but not outside the United States. Some of our clients like these plans because it's like you pay as you go. They really enjoy the zero or very low premium since they're living on a budget. And again, you only pay copays when you use the plan. However, I always point this out, if you become unhealthy and you start using the plan frequently, you could end up paying a little more on a Medicare Advantage plan. For example, let's say you went to the doctor and he sends you next door for blood work, then to imaging for an MRI, and then to another specialist on the next floor for another test that he can't perform. Just remember, these are all different copays, and you having to pay multiple copays for multiple tests, it may end up being a little more expensive with the Medicare Advantage plan versus a Medigap plan. Always consider thoroughly your health history when you're making a plan decision. Also be aware that Medicare Advantage plans will change each year. The benefits may change, the premiums may change. Always be on the lookout for your ANOC, your annual notice of change. By law, the Medicare Advantage plans have to notify enrollees of any upcoming changes for the new year. And remember, providers can change year to year too, even during the year. You're locked in for the year, but they can actually be added to the network or come off the network. So when you're looking into a Medicare Advantage plan, be flexible. Here is the number one question. For the Medicare Advantage plans that have a zero premium, people will say, how in the world can they charge a zero premium? That's a good question. Remember, when you enroll into a Medicare Advantage plan, original Medicare is no longer your primary. The insurance company becomes the primary payer of all your claims. The government sends the insurance company a sum of money per enrollee per month to administer your benefits. Medicare is no longer primary. Instead, all your bills are sent directly to the insurance company, and they pay all the claims using the money they receive from the government. We are the Knowles Insurance Agency. I'm Samantha Knowles. Feel free to call us anytime with any questions or visit us. We are the Knowles Insurance Agency.net, NET.